Hello,
Hello.
how are you?
Fine.
My name is Kurt Aldridge. I am a nurse and I'm studying to become a registered nurse with a BSN, and I'm doing your assessment today. Would that be okay?
That'll be fine.
All right. Tell me what your name is.
My name is Christy Booth.
And how old are you?
I am 55 years old.
Great. All right. Christy, let's start, and I'd like to know a little bit about you to start with. Tell me where you're from, where you grew up, that sort of thing.
I'm from Knoxville, Iowa, but I currently live in Platte City, Missouri. I'm a business manager of an entertainment farm, and I'm going to be a grandma in July.
You are?
I am.
Oh, wow. Is that your first time?
First time.
Wow, big occasion.
Yeah.
That'd be a lot of fun. Great. All right. Well, what brings you here today?
Just check up.
Just a checkup, okay. All righty. Well, we can certainly do that for you. I'd like to tell you a little bit about how we go about doing it. Since this is a simulation, some of the things that we're going to be doing are a simulation, and we'll just do them the best that we can. We don't have an otoscope or a ophthalmoscope or a couple of other things, but we'll get by, okay? And the way that we start is generally I start at the top of the head and I work my way down the body. And we look at a lot of different things. It's not each individual part, it's things which go into it. Sometimes the physiology of it and the neurological and digestive things that you may not even see. So you'll see me ask some strange things, ask you to do some strange things, and if you have a question, I encourage you to go ahead and ask. And otherwise, we'll just go ahead and go through these very quickly. And sometimes perhaps just simulate them for the sake of time, because sometimes a full, comprehensive, practical assessment, objective assessment can take a little while to do. Generally, we'll go through and we do inspection first, and where we're looking at you, and then move on to auscultation, and where we listen, and then we'll palpate, and we'll percuss. And so that's generally how we do it. And I think that we are just about ready to go. I'm going to wash my hands, and so just give me about 30 seconds here and I'll wash up. Wash, wash, wash. And so I have done that, and I am ready to continue on with what we are doing. I'm going to start off with vital signs.
Okay.
And so I'm going to take your temperature, and this is something we're going to simulate. And because that's not a real thermometer, but anyway, so you have a thermometer in your mouth, and I'm going to have you sit up here on the table, and I'm going to take your blood pressure here real quick, and yeah, it does a little bit better if you don't do it over close. What's it?
It's cold.
I know, I'm blocking the camera. Okay. Okay, got it. And we were at 130/80. And I'm going to check your pulse. Just relax. And generally we listen, or we feel for the pulse for about 60 seconds. We may not spend quite that long right now. Your pulse is running about 64. And why I've been doing that, I've been assessing your respirations for the past minute, and we are at 17 on that. I'm also going to do a pulse ox on you. Some toys I have and some I don't. I'm at the firehouse today, so I do have a few toys. And I can even do a D-stick on you. And we'll take the thermometer out of your mouth, and we are at 90.
98.5.
98.6 on that. Lay that back over here. And your pulse ox is at 99. And that says a 71 pulse. And you know what? I think for the sake of time, I'm just going to simulate it. And so we will go ahead, we'll do our alcohol, we'll do our stick, and drop on some blood. And we know from previous experience that you are not diabetic, and hopefully will run anywhere from 80 to 120 ideally.
Mm-hmm.
Okay, so we simulated that, all for the sake of time. Okay, so we have our vital signs done. We have a D-stick, a temperature, a heart rate, a blood pressure. We're going to assess your pain. That's the 5th vital sign. And from a scale of 0 to 10, 0 being no pain to 10 being the worst pain, and we're kind of thinking from a chronic point of view, what would you rate your pain?
0.
0.
Not pain.
Okay, that's the way to do it. All right. Okay, the first thing I'm going to start off with is your skin. Oh, that's right. Let's get your height and weight. Come towards me. If I just. And once again, we're going to simulate this because I do not have a scale. Okay. And your weight is 170. 170. Okay. And your height is at 5 foot 6 inches. So if we look at our BMI. I believe that comes out to 28. So we're a little bit predisposed towards possibly being overweight. So is that possible?
Yeah.
Remotely possible?
Yeah.
Okay. And just to do a little bit of teaching, you know the fact that the things that cardiovascular wise and stroke wise and all those things that pre-hypertension and weight needs to come down just a little bit, right?
Mm-hmm.
So next time I see you, I know that you're going to be working on that, right?
Right.
Okay.
Sure.
Yeah, okay. So, okay, I'm going to start now. You okay?
Yeah.
Okay, I'm going to start now at the top of your head. I'm going to look at your hair. And I can see that it's nice and shiny. You're a blonde. And I'm looking around for any kind of infestations, anything like that, any alopecia. Don't see anything. Everything looks great there. I'm going to come down, and we've already talked about your skin here a little bit, and we're going to check over the sternum to check for any kind of tinting or edema going on, and I'm not seeing any. I look at your face, and I see some lentigens, some H-spots, is what they call them, which is actually caused by the sun quite a little bit. And once again, you know from you being a blonde and having blue eyes and living on a farm that you should be using sunscreen. Are you using sunscreen? And what protection are you at?
70 usually.
And you're using it every time you go out there.
Well.
You're using it in the wintertime.
No.
You're going to use it in the wintertime.
Okay.
Absolutely. Every time you go outdoors, you got to have that on because the sun is very bad in this day and age. So, okay, so now you're taught. Okay, let's go ahead and we're going to go with our smile, and I'm going to check out some of the cranial nerves. And so, once again, if I ask you something that seems crazy, just bear with me. Can you do a frown for me? All right. Can you, big smile, show your teeth. Okay, wrinkle your forehead. Very good. Okay. Let's see if you can discern touch. Tell me if this is sharp or if this is dull.
Dull.
What about that?
Pointy. Sharp.
Pointy. Okay. So you can discern touch on your face. I'm going to palpate. I'm going to palpate your temporal pulse, and I do feel it. And since I'm right here, I'm going to go ahead and palpate your temporal mandibular joint. And can you open your mouth? All right. Are you having any pain opening and closing your mouth? No? All right, good. Can you clench your teeth? Grind them back and forth laterally. Okay, very good. All right, sounds good. And let's see. Let's go ahead and just inspect the inside of your mouth. We look at the lips, and they're moist and they're pink. There's no signs of hypoxia going on. So now we're going to look inside. We'll look at the buccal mucosa on the sides, and it is nice and pink. We're going to look down at the underside of the tongue. Can you put your tongue up? And nice. And I can see the frenulum. I can see the salivary glands underneath, and all of them look like they're painting. Okay, now put your tongue down. Look on the dorsal surface of the tongue, and it's moist, it's pink. I can see the papilla, and I'm going to look down at, I'm going to look up at the top at the hard palate and the soft palate, and it looks good. I have a pen light here that's going to help me do those things. And once again, we're just inspecting. Can you open your mouth again? Okay. And I can see the uvula, and I see the tonsils. There's no infection, there's no redness. I'm going to check for the gag reflex here. She likes that, I'm sure. And if I go midline and on the tongue and back to the posterior pharynx, and she does have a gag reflex. You want me to do it again?
No.
Okay. And so we checked out that. Once again, open your mouth. Can you say ah?
Ah.
Okay, I see the uvula moving up when she does that, so that's what it should do. What else? Oh, we got 32 pairs of teeth in there, and I noted before we have various caries in the back of them which have been filled. It looks like her incisors in the front are overlapping the bottom ones, which they should do. The molars in the back are meeting each other, just as they should when a person chews. Okay, let's check tongue strength. Can you take your tongue and push against this jaw? Do it against the other jaw. Good. I'm going to go ahead and try our taste receptors. And can you close your eyes? And I'm going to put an item on here, and I'm going to have you taste it. Can you tell me what that is?
Sugar.
All right, excellent. And I'm going to try it again with another substance. Could be rat poison. And tell me what that is.
Salt.
Salt. Okay, very good. Excellent. Okay, so that's what we have for the mouth. Let's see. Let's look at your nose next. If I had a otoscope, that would be ideal. And excuse me, because my glasses are so bad I'm not seeing. Can't do anything without glasses. And we're going to check airflow first. Look up at me. And I'm going to include one nostril. Can you smell? Okay. And the other one? Can you go ahead and breathe? Mm-hmm. Okay. All right. I'm going to test her sense of smell. Close your eyes once again. What is that?
Coffee. Cheap coffee.
It's full rich. It's the richest kind. Okay, close your eyes. Smell?
Garlic.
It is garlic. Okay, very good. Our otoscope, we would take that, we would go inside each of the nostrils, we'll look at the nares, we'll look at the turbinates, we'll see that the septum is midline, we'll go ahead and do that on the right side, do that on the left side, and check that out. The last thing that we're going to do is check out the sinuses. We'll check out the maxillary sinuses and the frontal sinuses, and you can do that and see if there's any fluid in there by taking this light and see if it illuminates it. And that looks clear, and the right side looks clear.
2507 South 17th Street, EMS 2507 South 17th.
And we'll look at the maxillary sinuses, and I'm not seeing any kind of consolidation inside of there. So I think that completes our look at the nose. If I can turn that off. Excuse me. Okay, let's look at the ears here real quick. And the ears, I can bend them. They're flexible. The auricle rebounds, or the pinna, I should say, rebounds and the same side with the other, same thing with the other side. The tragus is in place. I look at the external ear, and I see that the canal looks clean, and everything is in good order on that. Once again, I would take the otoscope. I would look inside and visualize the membrane, the tympanic membrane, which should be pearly and gray. So I will do that in this ear, and I will do that in this ear over here. So that is good. The last thing that we're going to do with the ear is perform what's called a whisper test to tell just what her acumen is with hearing. And to do that, I have her stand, and I come behind her approximately 2 feet, and I whisper, this will be a 2-syllable word, and I have her repeat it.
Football. Basketball.
Okay, great.
That's 3 syllables.
No presbycusis. Okay, and the last thing on the face that I want to do is the eyes. And I'm going to inspect the eyes first off, and I'm going to take a look at them. I'm going to look at the sclera, look at me, and it's nice and white. I check the pupils, and it's pinpointed. The cornea is clear, transparent. I can see the lacrimal apparatus, and I don't see any exodus, any kind of discharge going on with that. The palpebral fissures are in place. I'll come up and check the bulba conjunctiva. And I could invert the eyelid, but I don't think she wants me to do that. Okay, and that all looks clear. If I had an ophthalmoscope, and I'll pretend that I do, I would come in at a 5-degree angle, and I'd look through the cornea into the fovea, and look back and visualize the optic disc and look for the red reflex. That would give me an indication of whether or not we have pressure building up, which could be a problem that causes glaucoma. Make sure the retinal vessel is intact and working. So I will do that with this eye, come over here with this eye, and do the very same thing at a 5-degree angle and look for the red reflex. Let's see. To test here, I'll check the 6 cardinal gazes, and we're going to start up here. I don't want you to move your head. I just want you to start out looking at me. Okay, now look at this object. Just follow it with your eyes. Okay, very good. It looks like the superior oblique and the lateral rectus and all those muscles linked to the cranial nerves are in place and working okay. I'll check for accommodation. Can you look at this pin? And I'm going to move it in. Can you follow it? And eyes come in. And that she is positive for that test. We'll check the pupils' response to light. And it's good if the room's darkened, but I'm not going to be able to do that. Look at me. Okay. All right. And over here, and with the light shining in there, the pupils constrict, and in darkness they widen up, which is what you want them to do. Let's see. So I think that will pretty well take us through the eyes. Have we gone through nose, eyes, ears, and we've worked our way down to the neck. So I'm going to start off inspecting the neck. I look at it. I see the trachea going here. I see the cricoid cartilage in here, and everything is midline and looks healthy. I don't see any swelling going on with this. I'm going to check for the carotid pulse in here, and we're going to auscultate, maybe, and we're going to listen for broods in the carotids. We'll use the small end. All right, I hear no pushing or swishing, so hopefully we don't have any broods going on with that. Let's let's see. And I'm going to ask her to take a drink so I can watch her cricothyroid work. We're also looking at the thymus, just make sure that that is not having any problems. I'm not seeing any signs of Cushing's, no myxedema, nothing that would concern the thyroid. So I believe that we're healthy there. And now I'm going to ask for her to do a range of motion, and we're going to try lateral motion. You can do it from just sit down.
Okay.
Just turn your head slowly. Are you having any pain doing that?
No.
Okay, how about extension and flexion? That's like going around, but that's fine. And lateral movement. Okay, good. You have good range of motion with that. Okay, let's look at your arms and your hands and your fingers. First off, I'm going to try a neurological test with you. I'd like you to put your arms out like that and close your eyes and take your finger, your index finger, and touch your nose. Okay, do it again. All right, and let's try it with your other arm. All right, take each one of your fingers and touch your thumb. Excellent. Your motor skills are good there. Okay, and we'll check for arterial sufficiency by checking her pulse points. We'll start with the brachial. And I do have a pulse there. We'll come down to the radial. And we will check the ulnar. All right, and we'll do the same thing over here. Radial. And the ulnar. While I'm here, I'm going to reach underneath her arm. I'll check for the epiclear. I'm not saying that right. We'll check the nodes. I always have trouble saying that. Okay, and I'm not feeling any kind of swelling going on in that. Let's see what else that we want to do here. The epitrochlear lymph nodes is what I was trying to say. Let's try your reflexes. I do not have a reflex hammer, but believe me, I can get her to move with this. So, okay, just kidding. Reach your arm, right there. Okay, just relax. Okay, up. Okay, and we have good reflex there. We're going to try it. We'll try it down here. Turn your arm just a little bit. Okay, very good. And let's try, And let's try it over here with this arm. And I'll use my thumb. And then we'll come over here. And we do have reflexes in both those arms. Let's try a shrug here real quick. I'm going to hold down on you and go ahead and try to shrug your shoulders. Okay, all right. And we know that that cranial nerve is intact now. I'd like to try what's called an Allen test. Once again, this will test your arterial sufficiency. I'll bring this chair up here, and you can, does that work? I know it's hard for the camera to see you, but anyway. Or I tell you what, let me point it around this side. Okay. Okay, you just put your arm up on the table. And I'm going to occlude the ulnar and the radial pulses. Go ahead and make a fist. Okay. And then I'm going to let loose of, in this case, the ulnar. I can rotate either one of them. And open your hand. And we see the color slowly coming back into the hand. Release the other one, and it picks up that much faster. And I'm going to do the very same thing to the right arm. We'll occlude both of them, make your fist. And I'll let go of the ulnar and open your fists. And it starts to redden up. So both of those arteries are patent. We'll check cap refill on her fingers. Just relax. And press in. And we have cap refill less than 2 seconds. Her fingers are nice and warm and pink. And so we're doing well on that. And you can take that seat back if you would. let's see, the last thing that I want to do is our range of motion. And what I'd like you to do is we're going to check the shoulder first, and which is what's called a universal joint, and we will come in like we're swimming. You're going to do a dive and then come back. There you go. All right, and one more time. Up and back. Okay, and let's try for internal rotation, I believe. And we'll come across here and lock, and then come back here. All right, and we have good rotation there. Okay, very good. We'll check the elbow and make sure that we have flexion and extension, and out and back in. And then we'll do a lateral rotation, hands in, out. Okay, very good. And now we'll check the wrist, and we'll do extension and flexion, and down, and back up, and over, and do lateral turning, and this way. Excellent. Good range of motion. I think that is going to, we're going to do another test that's called graphophasia, and make sure that she can recognize the objects. So you want to have a seat there? I want you to close your eyes. I'm going to write a number on your hand, and I want you to tell me what number it is that I'm writing on your hand.
3.
Okay, good job. Let me try it on the other hand.
4.
Okay, good. And in another test called stereogenesis, and once again, close your eyes. And I'm going to put an object in her hand. She's going to tell me what it is.
It's a key.
Okay. And next one.
Paper clips.
Okay. And next one.
Kleenex.
Okay, very good. Okay, so we have done the upper extremities. We can go down and do the lower extremities now. And I'm going to, once again, I'm going to check the reflexes. First one I'm going to test is the knee reflex and the patella. Okay, I'm just kind of simulating this because this is actually hammer and hit over there. Okay, great. And I'm going to try the Achilles reflex, and that's back on this side. Okay. Okay, very good. And let's see, I still have I still have a plantar reflex that I want to try, but I'll wait till we're laying down for that, which I think that we're pretty well ready for doing. Right now, I'm going to check your cap refill on your toes, and we have good cap refill, less than 2 seconds. Her toes are a little bit cold, but not too bad. They have good coloration. Once again, I'm going to do inspection. I look at her legs. We have a little bit of varicose veins right here. So we may be a little bit concerned about, at some point in time, neuropathy or venous or arterial insufficiency. So we're going to check those things out. There are tests to do that, and we'll get into that a little bit here on doing that. I think I'm going to go ahead and have you, I can do point testing here too. Close your eyes and tell me where I'm touching you.
Top of my knee.
Okay, and is that blunt or sharp?
Blunt.
Okay, where am I touching you here now?
Inside of my shin.
Okay, and what about now?
Other knee.
Okay,
Above it.
sharp or blunt?
Blunt.
Okay. Okay, at this point, I think I'm going to have you lay down.
Which way do you want me to get my knee?
Yeah, probably head that way. Sorry. And I'm going to check for the patency of pulses. It's cold in here. And the first thing that we're going to check is the femoral pulse. And we do have a pulse up there. We'll check the other side. But we'll up here we're going to check the equidal lymph nodes and make sure that there's no swelling going on with that. We'll come down. We'll check the pulse on the popliteal on the right side. We have a pulse. We have a pulse back here. We'll go to the foot and check the dorsalis pedis. And we do have a pulse on that. And we'll come back to the posterior tibia pulse. And we have a pulse there and a pulse there. At the same time that we're doing that, we are going to go ahead and auscultate and make sure that we don't have any bruits going on in the femoral artery. We use a small bell. Okay, and that appears to be good too. Oh yeah, we forgot the plantar reflex, and we'll do that, and through here, and that looks good. We'll inspect the toes and the feet. They all look good. They're in line. The phalange seems to be working. We're going to try a little bit of range of motion here. Can you go ahead and do flexion and extension? Okay, how about this foot here? Okay, and can you bend your toes? Just your toes down. Okay, back up. Very good. Okay, how about your knee? Can you bring that towards you? Okay, and put it back down. And let's do it with this one. All right, bring it back down. Let's try your hips. Can you lift your whole leg up? Very good. Wow, I'm impressed. And lift this leg up. Okay, very good. And how about to the side? Can you move to the side?
Like that?
No, the whole leg just out.
Oh.
There you go. That's good. You're getting carried away, but that's good. Okay. Very good. Okay. Okay, I think that we are ready to try walking. If you will stand up, Miss Christie. And the first thing I want to do is a Romberg test, and I want you to face me. And, well, maybe. Okay, just, yeah, okay. And just close your eyes and stand there, and we'll just, you would normally hold this for about 20 seconds and make sure, and stand here and catch her if she falls, and make sure she doesn't lose her equilibrium. This is a test for the vestibule in your ear or the cerebellum, and make sure that your equilibrium is okay. Now we're going to try walking. So, do you want to lose that for a second? Okay, and if you just walk out there about 5 foot, and I'm looking at the hips to make sure that they're in line, horizontal to the spinous process. I'm also looking at the spine, make sure that we don't have any kind of curvature or scoliosis or kyphosis, lordosis going on with that. I'm going to ask you to walk heel to toe. Excellent. Okay. And now walk on your toes. And Simon says, walk on your heels. Okay. Excellent. All right. You can have a seat. I think that pretty well, let's see, I've tried all my pulses. I believe that pretty well gets us through our legs. And so you're looking very good, very healthy young lady. Yeah. Okay, so that brings us to the chest, and so once again, I'm going to start out, and I'm just going to inspect and make sure that everything is where it's supposed to be. I can visualize all her 12 pairs of ribs and see her breathing. I'm going to check for the tidal volume, her inspiration, tidal volume, and I do that by using palpation. I'll come along the coastal margins and ask her to take a deep breath. One more time. And I watch my thumbs move up, and they move up from 2 to 3 centimeters, so I believe that she's having full excursion of both lung fields bilaterally. I'm going to check for fremitus, which is a check by palpation in the upper lung loads, and by asking her to say 99.
99.
And how about on this side?
99.
Okay, and so I do hear fremitus going on, which you should hear up in the upper lung fields. Now I'm going to oscillate, or excuse me, I'm going to go ahead and percuss over these lung fields, and I'll come up here and I do have tympany up in the higher areas and resonance as I move down into the lung fields, which is exactly what you should be hearing. So we're okay with that. So I'm going to do the back of her at this time. I'll just go around over here. And we're going to do the same thing. I look at her neck. I make sure that the cervical spine is in line. You're not complaining of any pain, is that right? Okay. And once again, I can check for any lymph nodes that may be swollen. And we'll come down. And now I'm going to percuss and listen over both lung fields. And so, and we're all over the scapula.
Okay.
And we just work our way down and try the different intercostal muscles as we go down in the mid-axillary line. And we work down to in the area of T9. And we are getting resonance on that side, and that's exactly what we should hear. And now we're going to oscillate on those same fields. And take deep breaths. Okay, and I'm going to look at the axilla lymph nodes and make sure that they're not swollen. And I'm going to come around on the front side since I haven't oscillated over there just yet. And I'm going to listen to that. And I'm hearing clear lung sounds. I'm not hearing any rails, any rattles. I'm not hearing anything that may be considered wet. Lung sounds are all good. So that's going to take us to our abdominal area. And so I'm going to expose that area a little bit. And I think the first thing I'm going to have you do is to lay down. And I'm going to look across your chest and look across your stomach and just kind of look at the contour. And I see the tummy's a little bit rounded. That's probably from that BMI of 27. And I see that the umbilicus is in line, that there's no signs of bruising around the umbilicus. And I'm going to I think I'm going to go ahead and listen to all the quadrants right now. I'd rather listen before I start palpating. So I'm going to listen to all four of the abdominal quadrant, and what I'm looking for is abdominal sounds that would indicate that we have peristalsis going on. And I should be hearing at least one sound maybe every 10 seconds, every 15 seconds. And we'd also oscillate each quarter probably as much as a minute, but I'm not going to spend that much time doing that right now. Okay, good. All right. At this point, I'm going to go ahead and palpate. What I'm palpating for is for an enlarged spleen, for an enlarged liver, for an aorta that may be about to rupture, looking for masses, any pulsating masses going on. We'll do a light percussion to try to detect that, and then we'll go back and do a deeper palpation to try to discern the borders of those various organs. And as I said, this is just light touch that I'm using right now. All right, and everything feels like it's fine. I can feel the bladder down here is not distended. Everything seems to be within parameters. I'm going to go over and check the spleen on the left side, and I come down and I'll just hook my fingers, and it's underneath the costal margin, and I can feel it, and it's within parameters as far as size.
St. Joseph Avenue, East Franklin Street, EMS, St. Joe Avenue, East Franklin.
And I'll come around to the right side and palpate the liver. Some people can palpate the gallbladder. I've never been able to do that. Okay, so I'm not feeling any enlarged organs in the abdomen. So, and that brings us down. I'm going to check the pelvic girdle, make sure that that's in place. Are you having any pain when I do that? Okay, great.
St. Joseph Avenue, East Franklin Street, deputy
What
traffic stop,
else
male
do we have to
having
do?
chest pains, respond emergency. St.
Oh,
Joseph
and
Avenue, East
that's
Franklin
right, we
Street.
got to check cardio. So let's do that. Have you sit upright. And the main thing that we're going to test, if we had a problem before and she'd had a history, we might do an EKG, we might do a stress test. She's indicated that she doesn't have a problem right now in this test. We are going to auscultate. We can palpate for the point of maximal intensity. To find the PMI, we'd come down here, find the angle of Lewis, step out to the side. That would bring us to our second intercostal space, follow that down to the fourth or the fifth intercostal, and come over to the mid-clavicular line, and that's where we would find the point of maximal intensity. So I can go ahead, I can palpate that with my palm of my hand or with my fingertips, and I can feel that. And I'm going to go ahead and auscultate. And I'll come around and I'll check the various fields. I'll check the pulmonic valve, and I'll check the aortic valve. So I do hear that. I hear my S1 and I hear the S2. The valves are closing properly. The mitral valves are closing properly. She has a regular heartbeat. There's no dysrhythmias. Not seeing any indication of problems. with anything to do with cardiac. What does that leave? We've checked all the systems. So if this was a regular physical, we would check the genitalia, but since we're on camera, we will not check that. We'd also do a check breasts for possible masses or cancer going on with that. But today we're not going to do that. So I think that pretty well ends our physical. Do you have any questions, anything that you want to ask me?
No, I do
You
not.
look like you're a pretty healthy young lady.
Just tired.
Just tired. Okay. I thank you for your help.
You're welcome.
Okay.